I used to think a stroke strikes without warning, like lightning out of the blue, until I learned something that changed everything. Our bodies often scream for help, but too many of us don't listen. A moment of dizziness, a stumble, a slurred word, an unusually deep sleep. These aren't just signs of getting older, they could be the silent symptoms of a coming stroke, sometimes up to 7 days in advance. And here's the heartbreaking truth. Over 40% of people who suffer a full-blown stroke had a TIA, a mini-stroke, just days earlier, but they ignored it. Please don't let you or your loved one be the next. If you're over 60, have high blood pressure, poor sleep, or a history of TIA, watch this video to the end, because one small decision could save your life.
Before I share the 10 early warning signs of stroke, let me tell you a true story. It's about Walter, 68 years old, living in Indiana. One Monday morning, he woke up feeling a little off, dizzy, off balance. When he got out of bed to use the bathroom, he had to hold on to the wall. His wife asked, "Are you okay?" He smiled and said, "Probably just slept wrong. I'm fine." He skipped breakfast, drank a cup of coffee, and read the newspaper like he always did. But 30 minutes later, when he picked up the phone to call his son, he couldn't speak. The words wouldn't come out. His mouth sagged on one side. His wife panicked. They called 911, and the doctor said, if you had waited just 15 more minutes, he could have lost the ability to walk or speak permanently. They also said something else. The dizzy spell, the slight slurring from 2 days before, that was a TIA, a mini-stroke. His body had tried to warn him. I'm not telling you this to scare you. I'm telling you so you can prepare. Because if this could happen to Walter, a man who didn't smoke and walked every week, it could happen to me. And to you. So now, let's walk through the 10 early signs your body might be using to warn you before it's too late.
Number 10. The morning rush at ignoring hydration. If your mornings consistently start with a jolt, rushing around, immediately diving into stressful tasks, and crucially, skipping that first glass of water, your body is under duress. After hours of sleep, you're naturally dehydrated. This thickens your blood, putting extra strain on your heart and increasing clot risk right from the get-go. This isn't just a bad habit, it's a daily physiological stressor that elevates your long-term stroke risk. The life-saving shift? Prioritize a glass of water before anything else. It thins your blood and gives your cardiovascular system a gentler start. Number 8. The no time for breakfast or caffeine first trap. Skipping breakfast or delaying it significantly after waking, or making coffee or tea your very first intake before water are major red flags. When your body has gone 8 to 10 hours without food, blood sugar drops, and stress hormones like cortisol and adrenaline surge to compensate. This raises blood pressure and strains your blood vessels. Similarly, caffeine on an already dehydrated system acts as a diuretic, further thickening blood and causing blood pressure spikes. The brain-fueling fix? Eat something, even small and healthy, within an hour of waking, and always hydrate with water before your caffeine. Number 7. Persistent fatigue and unexplained sleep pattern changes. Too little or too much sleep. While occasional tiredness is normal, sudden, overwhelming, or chronic fatigue that isn't relieved by rest can be a warning. Furthermore, consistently sleeping less than 7 hours or more than 9 hours has been linked to increased stroke risk. Sleep deprivation elevates blood pressure and inflammation. Oversleeping can be associated with metabolic conditions like obesity and diabetes, which are stroke risk factors. Your sleep patterns are a window into your cardiovascular health. The restorative action? Aim for 7 to 8 hours of quality sleep. If you experience persistent, unexplained fatigue or drastic changes in your sleep needs, discuss it with your doctor.
6. Ignoring known lifestyle risks. Smoking, excessive alcohol, sedentary behavior. These might seem obvious, but they are powerful daily votes for or against your brain health. Smoking or regular vaping first thing in the morning introduces carbon monoxide, reduces oxygen, and damages blood vessel linings. Excessive alcohol use raises blood pressure. And a sedentary lifestyle, especially sitting for hours right after waking or throughout the day, slows circulation and promotes clot formation. These aren't just bad habits, they are active contributors to stroke risk. The protective pivot. If you smoke, seek help to quit. The benefits start immediately. Reduce alcohol intake and consciously break up long periods of sitting with even 1 minute of movement every 30 minutes. 5. Unexplained changes in your senses or fine motor skills, even if they seem temporary. While the fast symptoms are critical, which we'll cover next, sometimes earlier, more subtle warnings related to your senses or coordination can occur. This could be sudden blurred or double vision, sudden unexplained numbness or tingling, especially on one side of the face, arm, or leg, sudden difficulty with fine motor skills, trouble writing, buttoning clothes, or a new clumsiness, sudden changes in hearing, taste, or smell. Though less common as isolated stroke warnings, they contribute to the overall picture of neurological change. The attentive action. Any sudden and unexplained change in your senses or coordination warrants medical attention. Don't brush these off. 4. Any of the fast symptoms, even if they seem to pass, TIA warning. This is where we get into immediate acute stroke warnings, but sometimes these can appear as a mini stroke or transient ischemic attack, TIA, days or even a week before a major stroke. A TIA has the same symptoms as a stroke but is temporary, usually lasting less than 5 minutes, with symptoms resolving within 24 hours. F. Face drooping. Does one side of the face droop or is it numb? Ask the person to smile. Is the smile uneven? I. Arm weakness. Is one arm weak or numb? Ask the person to raise both arms. Does one arm drift downward? S. Speech difficulty. Is speech slurred? Are they unable to speak or hard to understand? Ask the person to repeat a simple sentence. T. Time. If you or someone else experiences any of these signs, call 911 immediately. A TIA is a massive warning sign. About 1/3 of people who have a TIA will go on to have a full stroke within a year, and for many, it's within 7 days.
3. Sudden, severe headache with no known cause. While many headaches are benign, a sudden, excruciating headache, often described as the worst headache of my life, can be a sign of a stroke, particularly a hemorrhagic stroke or bleeding stroke. This is different from your usual tension headache or migraine. It comes on abruptly and is intensely painful. The urgent response. Do not try to wait out a sudden, unusually severe headache. Treat it as a medical emergency and seek immediate help. 2. Sudden dizziness, loss of balance, or trouble walking. If you suddenly feel intensely dizzy, lose your balance, or have trouble coordinating your movements, stumbling or veering to one side, this can be a critical warning sign. This isn't just feeling a little lightheaded. It's a significant and abrupt change in your ability to stay upright and coordinated. The stability check. These symptoms, especially if accompanied by any other fast signs, require immediate emergency medical attention. 1. Sudden confusion, trouble speaking or understanding speech. This is a major indicator that the brain's language or cognitive centers are being affected. You might suddenly feel disoriented or confused about where you are or what's happening. Struggle to find the right words or form coherent sentences. Slurred speech is also part of FAST. Have difficulty understanding what others are saying to you. Experience sudden personality or behavioral changes that are out of character. The clarity call. These cognitive changes are serious red flags. Call 911 immediately.